I'm your host, Dale Sherbeck, and welcome to the HQ podcast. For those tuning in for the first time, the HQ is a podcast serial produced by CHA Learning and is your trusted source for important conversations on healthcare issues and topics from those that are leading and impacting the health system. Together, we'll explore these topics as we continue to learn together. CHA Learning is the professional development division of Healthcare Can and is uniquely Canada's only national fully online learning provider serving all of healthcare. So please check out more about our learning programs and services after this episode and discover how we collaborate with health leaders and organizations like those we feature on the HQ to empower healthcare professionals with the knowledge, skills, and relationships to impact health system improvement. Thank you, listeners, for joining me today. Over the past few months, I have had conversations with several inspiring leaders who have helped us unpack the issues of planetary health and view it through various lenses, from supply chains and waste to healthcare's own negative and potentially positive impact on our environment. We've also discussed the social impact of our environmental practices on health equity, or how we can reframe the idea of health itself and go beyond Western systems and paradigms. But through all of it, I have tried to keep the emphasis on the role of leadership, with the goal to learn how leaders are moving to eco-action and thereby provide hope and lessons on how any of us can make a difference on this issue. As those who have followed along with this series have no doubt determined, the issues are big and numerous and run the gamut from the macro, like the health of our planet, to those more micro and tactical, if that is a fair way to summarize, goals like reducing waste, emissions, or energy. And then there's the stuff in between, the processes and the practices, which are more social and cultural in scope. Today, we're going to take a deep dive into how one province, Saskatchewan, and its one health system, the Saskatchewan Health Authority, is addressing the specific issue of sustainability, which, as you'll hear through our conversation, has a couple of duly relevant meanings. But however you define it, sustainability is a key outcome of any successful change. Joining us today to have this conversation is Bryan Witt, the Vice President of Provincial Clinical Support Services for SHA. Bryan has served Saskatchewan as a healthcare provider, educator, and leader for over 25 years. Bryan began his career as a nuclear medicine technologist at Royal University Hospital in Saskatoon, and throughout his career has held a number of positions, including Director of Medical Imaging and Nuclear Medicine, a Kaizen Fellow, and the Director of General Internal Medicine and Ambulatory Care. Recently, Bryan was co-commander for the Saskatoon Integrated Health Incident Command Center during the pandemic and co-leader for the Saskatoon Capacity Response and interim vice president of the Integrated Saskatoon Health. Adding to his robust education, Bryan has also received his MBA from the University of Regina and has completed a fellowship in health system improvement from the University of Alberta School of Public Health, and he's a certified health executive. Through the philosophy of continuous improvement, Bryan is committed to serving patients and families of Saskatchewan through providing a consistent approach that supports both the delivery of high-quality healthcare and improved coordination of health services throughout the province. Hi, Bryan. Welcome to the HQ. I'm really looking forward to hearing about the great work you and your teams are leading in Saskatchewan today.
Great. Thanks for having me today.
So, thanks again for joining us, Bryan. And perhaps if you're comfortable with it, we might begin the conversation with your own journey about how did you get here? Why are you involved in planetary health and sustainability?
Thanks. Great question. My journey into planetary health and sustainability really began with a recognition of our, I guess I call it interconnectedness between
Hmm.
the human health and the health of our planet. Working in healthcare, I've seen firsthand how environmental factors like air quality, water safety, forest fire, extreme weather, how they can impact health outcomes. And so, in my role at the Saskatchewan Health Authority, I realized that a sustainable approach wasn't just an environmental imperative, but it's really crucial to building a resilient and efficient healthcare system. This work aligns for me personally with the vision also of SHA, which is healthy people, healthy Saskatchewan. So I see it as both a professional responsibility, but also just a personal passion of mine as well, too.
Yeah, and that's great when I guess our values align, right, with the places that we work and what drives us personally. So
Absolutely.
yeah, so some of our listeners are perhaps still grappling with some of these concepts that seem to be similar but overlapping, different in some respects. So When we're talking about planetary health, environmental stewardship, sustainability, what are the key questions that you think they should be asking, and how do they relate to your own system in Saskatchewan?
Yeah, like I said earlier, I think planetary health is really about recognizing that the health of our people and their planet, they are linked together. So for the Saskatchewan Health Authority, we're kind of focused on the idea of energy and environmental sustainability in healthcare. And for us, this really is going to be a focus on practices with strategies aimed at minimizing environmental impact of healthcare services,
Hmm.
while still balancing that with that high quality care and making sure that we're providing that. Our roots in Saskatchewan are literally I kind of jokingly say our roots are literally agriculture. And so
Yes.
we traditionally respect the land. So sustainability for us really means reducing our ecological footprint, but we still need to ensure that we're not compromising healthcare systems, and ensuring that we're delivering that quality care, not just for today, but for generations to come. For us, our focus with that energy and environmental sustainability is really about making smarter, more efficient choices today that protect the environment and promote that long-term sort of health imperative that we want to provide. We've initially here focused really in on like reducing waste, lowering energy and utility utilization, and using our resources more efficiently across our healthcare sector.
And why is it important? I'm begging the question because I know it's important, and we probably all get behind it. But what is that sort of, in your words, why is it important, and why is it important for SHA?
Think it's just overall sustainability of everything we do, whether it's the long term delivery of healthcare that we're providing, the environment, but really for me, I see that our operations need to be sustainable, and there's opportunities to do it in a way that not only saves us money in how we provide, but we can do that while balancing in supporting the environment as well too. And what we found is through these initiatives, there's huge potential in
Hmm.
saving dollars, and we can reinvest those dollars into healthcare and providing frontline care while protecting the environment at the same time. So there's a real synergy there, I think.
Yeah, and a good business case, obviously.
Absolutely.
So how did you begin this work then? Certainly, I think others are, depending on where they are in this own journey. How did you get your executive leadership behind this, your board, and get this going?
Yeah. When I started, I recognized that sustainability, it can be interpreted in a number of different ways across our teams and our people that work within the SHA. For some people, it's like almost like an abstract concept, and so we
Hmm.
really needed to work and understand where we're at. So we saw a lot of different pockets of individuals and teams within the SHA doing sustainability work, but as an organization, we weren't bringing them together or collecting information on how we were doing. It just really wasn't a single strategy. It was just these pockets of work that were going on. So for us, our first step to making it tangible was really doing an environmental scan of where we are as an SHA. What type of work is happening? Where is it happening? Who's leading that work?
Hmm.
And really starting to understand um, sort of where the passion lies within the organization, where the commitment is. And I have a background in lean methodology, and we often talk about pull. And so I wanted to identify basically who was doing that work, who was passionate about it already, and allow them to pull in and do more work within this. And so what we found is, we began to start to identify opportunities. Yeah, we already had some teams that were really leaning in on improving waste management or reducing single-use plastics. And so we wanted to kind of leverage that momentum and work with them and start to move that forward. In terms of sort of the larger executive leadership and board and securing that buy-in from the larger leadership team within the SHA, my focus was really on framing sustainability as an essential component of SHA's vision: healthy people, healthy Saskatchewan. And I was able to go back and look at case studies from other organizations and was able to link how environmental stewardship directly impacts patient outcomes, operational efficiency, financial sustainability. And so highlighting these cases from other organizations really showed that they were able to reduce costs and improve care through these green initiatives. And we could do the same. And so I developed a clear roadmap,
Hmm.
developed measurable goals. And I think having that roadmap, having the goals, and having case studies from other organizations really, I think, instill confidence within our leadership team and our board that this could be a strategic and data-driven initiative that can yield results that are positive for the SHA and the people we serve.
Yeah, that's a great set of exemplars in terms of where others can begin and follow for sure. And I think a lot of what I'm hearing in terms of what you've just been describing is is around alignment, I guess, right, between vision, what people are themselves passionate and interested in, like you yourself described at the outset, and then I guess giving them a clear set of directions or goals in terms of where to sort of move those things.
Yeah. From my perspective, I've always been an advocate of good business practice and sustainable business practices within healthcare, and I really see this as an avenue of almost untapped potential right now. When we're not doing that type of work, and it exists, that's a potential to drive savings and to drive efficiency. And so this is for our teams that are starting to get more engaged and involved, they're starting to see that potential as well too, and that ability for us to be able to save money and reinvest that back into frontline care is huge for a healthcare organization. So for me, I really see this as an exciting set of initiatives and an exciting journey that we're still in our early days, but it looks like it's going to be a lot of fun as we move forward.
That's great. Well, I can see your passion and hope our listeners can hear it in your voice as well. So, fun is a good thing to do. So, but speaking of fun and engagement, sort of, more overall, I mean, in terms of how you've engaged others in this space, you've talked about looking at what is already being done through your environmental scan and find out what people are passionate about. But do you think that, in terms of the rest of your workforce, are they more engaged in sort of concepts around like reductions and saving energy or these other kinds of green initiatives that you've described and perhaps we're going to talk more about as we continue on?
For sure, yeah. I think there's a balancing act that we need to utilize when doing these energy and environmental sustainability initiatives, and I say that in a way of on one side of that teeter totter is that energy and utility management, and
Yeah.
then the other side are more what I call green initiatives. And so, on the one side of the teeter totter, the energy and the utility management, it's really around getting those higher financial ROI initiatives, energy efficiency, waste reduction. Those I describe as lower visibility for the organization. It's kind of happening in the background as we try to do a lot of these initiatives. But the savings that we get from those, again, we can reinvest into healthcare. But my argument is we need to reinvest those into green initiatives that maybe have a lower financial ROI, but they're higher visibility for the organization. And I find that so important because those green initiatives improve patient outcomes and experience. They meet regulatory compliance and help reduce risk management. They help build relationships with our community, with our staff, with our stakeholders through leadership and advocacy and reputation and trust building. And it also drives innovation and leadership within our teams as well. So again, they might not yield the large financial ROI, but they're equally as important, I think, for the organization, if not more important. And so, for me, when I talk about engagement, I think we need to balance those two elements in
Hmm.
terms of driving savings, financial savings, but using that financial savings to still invest in those green initiatives that have that almost like a social engagement there as well too.
Yeah, I think, and that's sort of, I think, what I was trying to get at in my introduction as well. But it just, Is it fair to say that that's where some of the sustainability of the work that of the work itself that you're going to be doing, not the sustainability in terms of, environmental stewardship, but the sustainability of your initiatives is going to come through those green initiatives?
Yeah, absolutely, because that's where you get the momentum. And, you know, I used the term ROI earlier, like with financial ROI. You could almost call this like a green or social ROI on that other side, where
Yeah.
you're investing, and that return on investment is, building your teams, building that momentum, and building that work. And I think it as you do more and more, it is like a snowball going down the mountain there. It builds and it grows, and already in our early days, we've done the two sides. We've had the energy and the utility management that's created that financial ROI, but that hasn't got us the engagement from our teams. What has done is green initiatives such as a rooftop garden. And I'll probably talk about that a little bit later. But that really captured the passion of our patients and our staff and our families that we serve in the community, and they absolutely love that. And again, not a huge financial ROI, but it really helped shine a light on the importance of this type of work. It provided um, really homegrown vegetables and fruit to our staff, and it really allowed us to advance our own menus and really consider the food that we're putting on the plate. So it's just amazing how one initiative just grows and expands, and you get a really some great engagement from our teams. We never heard one negative thing. All the people involved and the people eating the food we just really enjoyed the fact that we grew it on the roof of the hospital, and they just thought that was just wonderful.
Yeah, but I can relate to that. Like, I don't get excited sitting on the side of my house looking at my hydrometer, right? Whether it's going faster or slower,
Yeah.
right? But sitting on, my back deck, looking at my garden, looking at the bees and the birds and the fruit that's growing, right? That gets me passionate. So,
Exactly, yeah, and then we can utilize that passion to help drive and sustain that change, right? And so an example, we did our pilot rooftop garden, and over the winter now we have a number of our facilities that want us to expand it and do this type of thing in their communities. And so that's a great where we want to latch on to, again, using my lean background, where that pull is happening. And we want to go with that pull and utilize that energy and keep this momentum moving forward.
awesome. Great. Thank you, Brian. So, would you describe this work as something that's, off on the side of your desk or other people's desks, or, is it becoming more, I guess, integrated itself in terms of the work that everyone's doing at SHA?
Yeah, it's a great question. And I think, for myself, I have a really large portfolio, and I can't think of it as being a separate project on the side of the desk. How or what my approach has been to it is sustainability is now being integrated into each of my portfolios is something that they need to consider and think about as they do their work. And so it really can't be treated as an optional type of work or a peripheral activity. It's really got to have that focus in order to gain that traction and to build resources that need to really make an impact within our system. So for us at the SHA, we're in our early days, but we are beginning to integrate sustainability into things like our strategic planning,
Hmm.
our operational frameworks. So, for example, now we start to consider sustainability when we're looking at different projects that we're doing, our procurement decisions, and things
Yeah.
like that. So, really starting to build that methodology into our processes and our practices. Like I said, we've developed and we're continuing to refine our energy and environmental sustainability roadmap, which is important. But I think more importantly, what we've also done is we now have a line and a section within our SHA strategic roadmap as well too. So that's important for me, and that was something I was passionate about getting put on there this year because it highlights the importance of this work being on our actual SHA strategic roadmap moving forward. So I think it's key, and we need to continue to consider the resources that we're putting into this in order
Yeah.
to continue that sustainability of it.
Yeah, that's certainly would be my question as well, right? In terms of if it, not just in terms of the human resource side of it, in terms of making it central, and I think as you've described, making sure it's visible in terms of your strategic plans and your priorities, so you can see it, which that you can then talk about it and you can measure it and monitor it, I guess. But what kind of resourcing, do you put behind it in terms of the financial parts of it? I know you talked about where those things will be reinvested.
Yeah, for sure. So I think overall resourcing sustainability in the early days probably requires some creativity and some a pretty strategic approach for sure. For us at the SHA, we're leveraging a mix of internal budgets, but I think it's important just to go after where possible external grants
Yeah.
and seeking partnerships as well too. I know we've been really successful in all three of those categories of building our own budgets, doing that external grants and the partnerships. I think other organizations, they've shown that sustainability investments will pay for themselves over time. And so having that argument and that mindset really allows us to move forward. But for us, the next step that we're really digging into is building a energy and environmental sustainability team. And I think even though we want to embed that into the work of each of our departments, we still need to have an overall leadership and direction and team. And I often talk about how the different elements kind of play a part. So I'll give an example. One what we want to develop is we want to have specialists or project managers scattered across the province, across the SHA,
Hmm.
that have a focus on driving initiatives within the local teams within their geographic area. So that's one element that we need. Another element we need is an investment that we have done into a data management system that collects the data and does that analysis. But you also need to have a certified energy manager who can do that analysis and sort
Yeah.
of assess a building and say, you know what, this building would really benefit from better windows or LED lighting or whatever that initiative is. So then we need people who can go after perhaps grants that can focus in on those types of initiatives, and they can do the required follow-up reporting on that as well too. And then you need to go back to the certified energy manager and the data management system to, once you install, let's say you get a grant for LED light bulbs, you put them in, you then have to get that follow-up to say, okay, did it actually make the difference that we predicted it would? And then you do that follow-up reporting. So it's really a collaboration of all these different elements that I think to really build that core sustainability moving forward, you need to have some dedicated team members who
Yeah.
can focus in on that work, help drive that work. But I think, and then the other piece I didn't mention too is people within the team and that leadership to build supports outside of the Saskatchewan Health Authority. So build partnerships with other organizations who are doing this work. So for example, with us in Saskatoon, we have a lot of focus, and we work closely with the University of Saskatchewan and the City of Saskatoon, who've done a lot of really great green initiatives. And we share the community with them. Our campus at one of our hospitals is shared with the university. So we work together, and we also have the Meewasin River Valley, which is a beautiful organization that works with protecting our river valley. And our hospital is right along the river valley. So we've
Yeah.
done some joint initiatives with them in preserving and bringing back the natural greenery of our environment. And so it's just great working together with these different partners and leveraging their momentum and their strength and adding it to our own.
Yeah, well, certainly your river valley makes one of the things that makes Saskatoon such a beautiful city for sure. Um, but I think you've also, described a little bit about, the resourcing part about, certainly not being on the sides of people's desks, dedicated people. But I think also, I think key what I'm hearing you describe is that they're specialists, right? That there's people who have got specific skills and assets that, that are crucial to be able to move this forward and to that ultimate sustainability.
No, I think it's so key, and like I said, I don't want to take away from the fact that we still need to build it in with each of our teams
Yeah.
and ensure that they're considering it. But you do need, as an organization, some dedicated focus and resources to really advance a lot of the bigger projects forward, and really to keep track of it. And that's the key is when everyone is doing little things, you want to make sure everyone's going in the same direction, and then collecting the data and measuring what's the impact of the work that everyone is doing. And so this is as we move forward and we get these teams established, it's really going to be key to really bring everybody together within our overall sustainability roadmap.
Great. Yeah. Thank you, Brian. So you've mentioned a few times about lean and your own background in lean, and certainly, for those that know about, Saskatchewan and SHA's work over the last couple decades, even you've made significant investments over that time, and in lean methodology and building out that lean culture. So I'm just wondering, what is the role or the impact, I guess, between lean and your sustainability work?
Yeah. Lean principles, really, for me, they have a cornerstone in our sustainability efforts. I kind of jokingly say lean helps us sustain the sustainability. And I should maybe trademark that. I don't know. I chuckle every time I say it. But what I mean by that is lean is the tools that we use to sustain that momentum with our efforts. Sustainability, it's not a one-time project. It requires that ongoing commitment and continuous improvement, which is the foundations of lean and healthcare. So lean's emphasis on standard work, continuous improvement ensures that sustainability eventually will become embedded into our daily operation. And it takes time and it takes that momentum, but lean as it can be a backbone for again sustaining that sustainability. As we do our work, every initiative needs to be measured.
Hmm.
It can be refined. It can be scaled based on its effectiveness. And we want to create that culture. We always want to create a culture in healthcare of continuous improvement. And I think the sustainability really aligns well with that philosophy.
Yeah, well, it makes great sense. I think, as you said, it adds that rigor to it. It adds a certain, um, I mean, so much of healthcare is evidence based in terms of its decision making and strategy. So, it provides supports for that too. It's not just about doing things because they feel good. I suspect, right? You're doing them because you can actually measure the impact and value.
Yeah, 100%. And even before we contemplated going down this energy and environmental sustainability journey that we're on, lean always aligned with ensuring that we are using our resources efficiently while providing the best possible care for our patients. So this just opens up another avenue of sustainability for us in using our lean tools.
Yeah, so you've talked about alignment with a lot of different facets of your strategy, your systems, your environment, and your overall society. So I'm wondering in terms of your relationship with your Indigenous and sort of Métis peoples as well. We had on one of our previous episodes last year, Dr. Nicole Redvers. Talking about promoting the inclusion of Indigenous perspectives in terms of some of the work, and certainly the work in the area of planetary health. So I'm just, where does that fit in terms of your strategy and the work you're doing?
Great question. I think personally engaging First Nation Métis communities needs to be a priority for us as we go down the sustainability journey. Indigenous perspectives offer, for me and for the organization for this work, valuable insights into land stewardship, resource management, and really that interconnectedness of humans and environmental health. And like I said, our roots in Saskatchewan are in agriculture, and really our roots are with the land here. So for us, we've really focused on building meaningful partnerships by listening to these communities and respecting their knowledge systems through connecting with their knowledge keepers. Um, where possible, we've tried to incorporate traditional knowledge into our planning process to ensure that the sustainability initiatives that we're doing reflect the priorities of all of our Saskatchewan residents. So that includes our First Nation and Métis communities as well too. So one example that I always think of when I talk about this is our nutrition and food services
Yeah.
across the SHA, and they've done a great job of working with Indigenous owned food operations, and they can provide us with traditional foods such as fish, wild rice, teas, different types of produce. And so
Hmm.
what we've done is not only have we been able to incorporate these foods into our menu, but we've also been able to use traditional Indigenous recipes through our knowledge keepers and embed that into our menus. And what we found and discovered as we did this work is there's a lot of regional variation within those communities. And so we've been able to really work with our local communities and adapt our food and our menus using local ingredients to really meet the food needs of those folks that live in those communities. So it's been a fantastic journey and great learning for us, and a great example, I think, of how that engagement can be so impactful to the patients that we serve and the residents that we have who live in our care homes. So it's been a great journey.
Yeah, well, I think that that would be another great conversation, another time to go more in depth about how you form those partnerships and develop
Anytime.
that together. Yeah, but I think it's something that we've heard through a lot of other sort of avenues about the importance of that kind of engagement and developing food service menus and delivery that respect the communities that you're serving. So that's a great example. Um, uh, you did talk about it, a few minutes ago around the rooftop garden. I certainly have heard about that in the news as well, and it's great that you're getting accolades for it, and it's inspiring more work or similar work across your province. What other kinds of great initiatives are you doing that you'd like to sort of share with our listeners here, Brian?
Yeah, for sure. Thanks. In regards to the rooftop garden, like you say, it's been a great success for us, and the beauty of it for us was it really allowed us to provide fresh, locally grown produce to the hospitals here in Saskatoon, and the benefits of that were tremendous in terms of just the staff engagement and the uptake that got. So that was fantastic. But I think again, I'll use another nutrition and food service example here. They do a lot of focus similar to what we do with our indigenous food partners. We work with local food producers to incorporate their products into our local menus. So the benefit of that is it really creates a more robust local supply chain, not having to rely on sort of the long supply chain. So that helps reduce emissions. You don't have your dependency on a single provider when you have a number of local providers. But what's great about that is not only are we diversifying our supply chain, but we're leveraging Saskatchewan's rich history of working the land and being on the land. And we're able to incorporate different items from across Saskatchewan into our menus. So again, there's a financial, environmental, and that social benefit. And so it's just great being able to work with those partners. Another example I can give is more on the clinical side of the house. So I've kind of talked a lot about energy, sustainability and nutrition and food services, but
Yep.
pharmacy is another area that falls under one of my portfolios that is doing a lot of great work in driving change through its sustainability initiatives. And so
Hmm.
they do a lot of focus right now on greenhouse gas emissions and in integrating environmental stewardship into pharmacy practices and operations. A couple of examples our teams are working on are addressing high emission pharmaceuticals, so phasing out dry powder inhalers and finding alternative. I think they're called metered dose inhalers, or optimizing our use of anesthetic gases and lowering the emission by using desflurane in place of desflurane. So that's another example where we can have a better environmental practice and actually drive some efficiencies within our system. And then lots of education is going on with our teams to our clinical staff around sustainable prescribing and administration practices to limit unnecessary waste. So that's a team that is a clinical team that, again, is really focusing in on the opportunities around their environmental footprints and creating more sustainable practices within the organization.
Hmm. Great examples. Do they, I guess some of those initiatives, the clinical initiatives you just described, are they, I guess, grassroots led? Are they coming from your clinical teams themselves in terms of identifying them, or are you scanning, I guess, the larger environment for best practices in terms of what's happening in other places, in terms of what you wanted to invest in?
I think it's a little bit of everything that you described there, and so what I mean by that is, um, I've done engagement with my leaders on my teams, and this is something that um, each of my leaders has really latched onto as an opportunity to really drive their business. And
Hmm.
think as a leader, it's important to find initiatives that your teams can find passion in and get energized by.
Yeah.
And we've been able to frame this in that way that these teams are really want to always continuously improve their business. And this is a new avenue of ways to do that. And so they are looking at what's happening across the country and the world in terms of these types of initiatives. How can we integrate those learnings into our own? How do we engage our teams? So it's been really a great to see my own team start to take this on and do that work to better understand. And there's lots of great data and analysis and work across all of my portfolios in different areas of sustainability. And so I think my teams have really enjoyed doing that work into to researching and seeing what's out there,
Yeah.
and then working with their own teams. And the other thing I think we found is we have passion within individuals within our team that really find sustainability is something that they really want to drive. And so, again, leveraging that passion within those individuals within our teams is key, I think, to our success.
Hmm. Thank you, Brian. So, what lies ahead for Saskatchewan Health Authority in terms of this work?
Like I said, we're just in our infancy. I think right now we're just starting our journey, and I think we've had some great first steps here. But scaling for us is going to be really important. Successfully scaling our projects, um, things like the rooftop gardens, but also our energy efficiency projects as well too. I think that balance and scaling that and moving that forward. We're so fortunate to have a Saskatchewan Health Authority that's so large and hits so many communities across this entire province that we can, I think, utilize the power of our SHA to scale a lot of these projects quite quickly, and we're hoping that that's what we're going to be able to do. Our vision is to not only highlighting the dual benefit of sustainability initiatives like environmental protection and that cost efficiency, but also commitment to that innovation of continuous improvement and delivering high quality care. I think we can link and do a great job of balancing sustainability and improving the care that we provide. I think the other foundations for us moving forward is continuing to embed sustainability metrics into our performance dashboards across all the work that we do. And then we talked about it earlier, but for me, a critical priority is deepening our engagement with our Indigenous community, really ensuring that their knowledge and values help guide the work that we're doing. I
Hmm.
think that's foundational for us. And I think the last thing is ultimately our goal is to create a healthcare system that not only heals, but is sustainable for future generations. And that's kind of the vision that I think we're using.
Yeah, it's a great vision. So, thank you very much for sharing, and all that you've collaborated with our other listeners. So, I mean, you talk about how you're sharing your own best practices internally, and how you scan, I guess, as well. I mean, I think part of what we're hoping to achieve through this podcast series is to have voices like yours, being shared throughout the larger community. So I'm hoping that you will inspire others through the work that you're doing, and some of your own approaches and strategies in this. Is there a way that others maybe can learn more about the work that you're doing, Brian, or if they want to connect with you, or to hear more about this?
Yeah, for sure. I'm with the Saskatchewan Health Authority. I could work with you and leave you my email address. And if people want to reach out to me, I'm happy to connect and talk about our journey.
Thank you, Brian. Any other words to you before we close off for this wonderful day?
No, Dale, thank you very much for having me. Happy to share the story. And I'm just I'm just really sharing the story of the great work of all the different people on our teams here that are really digging in and doing that work. I just get to tell their story. So
Well, it's great. I mean, certainly those that can't see you, I mean, there's a lot of Saskatchewan pride in terms of what your evidence there. Great passion in terms of your work, and it comes through very loud and clear. So, um, uh, thank you very much for sharing it so passionately and eloquently with everyone. And good luck on your future work together.
thanks for having me today.
Thank you. You've been listening to the HQ, and I'm Dale Sherback, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.